fatalities were ejected from the train. They flew out of those windows, and so a lot of people saying that if there were safety belts, they perhaps could have been saved, or at least wouldn't have been ejected from the train. So that's another conversation that's likely to be happening in the future.
Kristen Dahlgren, thanks so much. And the Obama administration today says that healthcare.gov is in stable condition, working more than 90% of the time. But does that mean a clean bill of health for Obamacare? David Seamus serves as Deputy Senior Advisor for Communications at the White House. He joins me now from New York. David, thank you very much. You set a fairly low bar, this sort of vague, working for the majority of people who want to sign on, and that 50,000 people could be served at any one time, 800,000 in a day. Is that good enough? What's the next step?
So, Andrea, as you know, this is going to be a process of continuous improvement. Compared to where we were in early October, as Jeff said yesterday, it is night and day, to the point where we can handle a certain number of concurrent users. We're monitoring to make sure the system is stable, that the response times are good, that the error rates are continuously going down. We've set up a queuing system for those instances where there's overwhelming volume onto the system to better manage the flow. We've set up a new anonymous shopping right on the homepage of healthcare.gov, so people can look at plans in a much more comprehensive way before they go on. But on an ongoing basis, this is a process where, based on what we learn, we continue to make these improvements. So by the time we get to the end of open enrollment on March 31st, as many people as want to sign up for some affordable health care can do that.
Now, we've confirmed at NBC that about 100,000 Americans were able to enroll through the federal exchanges in November. That's an improvement up from 26,000 in the federal exchanges in October. What can you tell us about the mix? How many of those enrolling are younger people, healthier people, the mix that is going to create the kind of risk pool that insurers wanted?
So, Andrea, I'm not in a position to really talk about the mix from what we saw in October and November, but let me direct your attention to the reports that came out of California and a few other states, and use that as kind of a guidepost to understand this. In the first month in those couple of states, they had about 23% of the total enrollees going in to the Affordable Care Act as being under the age of 35. Now, why that's important is when you look at the only other time we've done an experiment like this was in Massachusetts. In the first month, 17%, but that was very few people. But in the first 2 months in the Massachusetts experience, about 22% ended up being 35 years of age and younger. So what we've seen so far in those states that have reported those numbers is that the mix so far initially looks like it was in Massachusetts. After the full open enrollment in the first year of Massachusetts, you had about 29 to 30% of folks being under the age of 35 or healthy versus non-healthy as the better